A Brief History of Modern Medicine. This is Paul Gauguin's controversial painting. Where do we come from? What are we? Where are we going? If we do not have a clear idea of the history of modern medicine, it would be difficult to understand the current situation and where we are heading to. Medicine changes in response to many influences: scientific, technological, and social. New disciplines arise in a number of ways. Transformation from an older craft such as surgery and gynaecology, fragmentation from a larger discipline such as pediatrics, where an area of need was identified which was neglected by the existing disciplines. De novo, with the advancement of technology, otolaryngology, anesthesiology, and radiology. Family medicine was derived from an older branch of medicine, general practice. Let's go back to the 17th century. The profession, allopathic system as we know it today, has existed only since the 19th century. During the 17th to 18th century, Western society was served by various healers, tradesmen who sold medication, craftsmen who did surgery, and physicians, a very small group of people educated in UK and European universities. Apothecaries were tradesmen who originally dispensed and sold drugs. In response to need, they gradually took the role of the medical practitioner. Physicians were an elite group of learned men, educated in universities, who practiced among the rich and the affluent. They did not perform surgery or dispense drugs and did not associate themselves either professionally or socially with the craftsmen and tradesmen who ministered to the medical needs of poorer and rural people. Surgeons were craftsmen trained by apprenticeship. Surgical training improved, and Royal College of Surgeons had an examination combined with apprenticeship and hospital training, the MRCS. What happened to the apothecaries? The Apothecaries Act of 1815 gave the rights to apothecaries to give medical advice and supply drugs. This included a compulsory training with a 5-year apprenticeship to study anatomy, physiology, medicine, etc., that led to LSA. The birth of the general practitioner in the UK. Practitioners took double qualifications, MRCS and LSA, and also added midwifery training. The Lancet first used the term general practitioner in the early 19th century. By a slow process of response to social demands, surgeons and apothecaries were gradually integrated with physicians to form the modern medical profession. The process took many years to complete. The painting by Luke Fields depicts a doctor, certainly this cannot be a physician, doing a home visit to a sick child. The mother is distraught and the father looks on. 19th century was the age of the general practitioner in Europe and America. Please note that the word general practitioner is not the same as GP that is now used in the UK. In the USA, Abraham Flexner in 1910 submitted a report by the US and Canadian governments. He reported the appalling conditions of small medical schools in US and Canada. This was a turning point in the history of medical education and medicine that led to the Johns Hopkins in 1889. This was the first institution that was based on firm scientific foundation, and the staff consisted entirely of specialists. This reminds us of the similar incident that happened around 2015 that was initiated by a group of investigative journalists, not by the Indian government, that led to closure of nearly 350 substandard medical schools. So dawned the age of specialization in the 20th century. Factors that contributed to the age of specialization was rapid technological progress, investments on research, medical education became increasingly oriented towards laboratory science and technology, major specialities with training programs and qualifying exams, increasing prestige accorded to specialists. Value of technology and research skills over personalized care made general practice unpopular as a career. Pediatrics became the first subspecialty that broke away from the main group when William Osler said that the children are not small adults. So came a host of other subspecialties such as radiology based on technology, dentistry based on body areas and organs, and recently geriatrics based on the other end of the age spectrum. In 2011, clinical informatics was also named a specialty by the ABIM. And so will be the specialist in the near future, Gene 007. In summary, we have discussed a brief history of modern medicine beginning from the 17th century, covering the age of the generalist in the 19th century and age of the specialist in the 20th century. What will the 21st century be? The age of primary care and digital health. Thank you. Any questions?